Shalom, giving all praise and glory unto Yahweh, Ba'ashim Yahushai, Ba'ashim Kakadash, double honors to the elder apostles, elder bishops, and brothers on Dung and Great Millstone. Salutations to the whole elect. This is your brother Rai Banyamian, here to share the lesson. Lord willing, it be edifying unto the elect. And as per the article by K10 News, ABC, it says states are about to kick residents off Medicaid. And as you all know, with the job losses and stuff, and the economy going down, the housing market about to crash, the car market is in a bubble. You know what I mean? They are now taking a strike at the elderly. Now the elderly, you know what I mean, use these things, for their medication, to pay cheaper medical costs for their visits, right? So this is to answer a lot of questions, because people is going to have questions asking why is these things happening to them. As you all know, Mississippi, they passed the Jim Crow laws. They are back in effect, and a lot of people is asking questions why is these things happening to them, especially amongst our people. So both Edomites and the elderly of amongst our people is going to be wondering why is these things happening to them. One is because we have sinned against the Most High, right? He said that there'll be a time of Jacob's trouble. All these things is leading up to Jacob's trouble. And two, Esau is bringing that pressure, right? Because he wants his birthright back, and he's going to do anything by any means to make it happen. So the squeeze is coming on everyone, high and low, rich and poor, young and old. All right, so I'm going to read the article, share a few scriptures in between, and I'll close it off. Lord willing, it be edifying until elect. So it says, these 5 states will be the first to kick residents off Medicaid starting in April. By Tommy Lobby, CNN. It says millions of Americans are at risk of losing their Medicaid coverage in coming months, but residents in Arizona, Arkansas, Idaho, New Hampshire, and South Dakota will be the first to bear the brunt of the terminations. And this goes back to the scriptures where it say, rise ye and depart, for this, is not our rest. And I'll share that real quick in the book of Micah 2:10. It says, arise ye and depart, for this is not your rest, because it is polluted, and it shall destroy you, even with a sore destruction. Right? So this place is wicked, man. It's polluted with iniquity, right? It's polluted, with sin, right? And if you stay here in the world, you would be affected by it. What I'm saying? But at the end, as the prophecies say, this place would melt with fervent heat. It will be destroyed. What I'm saying? So going back to the article, it says states have been barred by Congress from winnowing their Medicaid rules since the C-19 began. It says that prohibition ended on Saturday, and some states are moving much more swiftly than others to kick off those deemed eligible for the public health insurance program for low-income Americans. So you see, we say they're moving quickly because Esau is coming out with great wrath, so he's kicking everything up. Notice that the economy is dying quicker and quicker every day. It says that worries advocates who say speed will result in eligible residents being incorrectly terminated. Also, it could hamper shifting those who no longer qualify to other types of coverage. This is the fable of the tortoise and the hare, said Joan Alka, executive director of the Georgetown University Center for Children and Families. Taking time is absolutely going to result in a bigger outcome for eligible children and family to remain covered. So speed is a big concern. It says 5 states will start cutting off coverage in April, followed by 14 more states in May and 20 additional states plus the District of Columbia in June. So you see the thing moving fast. It says all states must complete their redetermination over the next 14 months. And this is why the scripture says, we would be as pilgrims, upon earth. We would have no lodging in one place, because we can't rely on anything here. There's no structure for us here. And this particular structure that covered a lot of people, medical insurance, is about to be broken down. You know what I'm saying? I'm going to grab that real quick in the book of 2nd Ezra. Even, the Lord said that he didn't have, he says, foxes and hens have a place to stay, but the Lord don't have a place to lay his head. Just paraphrasing. This is 2nd Ezra, chapter 16 and verse 40. It says, "O my people, hear my word, make you ready to the battle, to thy battle. And in those evils be he as pilgrims upon the earth." So great evil is going to come upon us, as if in battle. Like a soldier, he don't stay in one place all the time. He's constantly moving, and we would have to be as such, as soldiers, right, in the evil days to come. We would have no security, no lodging in Babylon. It says around 15 million people could be dropped from Medicaid, according to various estimates. Those several million folks could find coverage elsewhere. Others may still be eligible, but could be terminated for procedural reasons during such as not completing renewal forms. Those at risk include at least 6.7 million children, according to a Georgetown analysis. Next heading, soaring enrollment. Medicaid enrollment has ballooned since March 2020, when lawmakers passed the Families First C-19 Response Act, which prevented states from involuntarily removing anyone from coverage. In exchange, Congress boosted states' federal Medicaid match rates by 6.2% percentage points. But that goes back to the rental moratorium. They kept they prohibited a lot of landlords from evicting people that wasn't paying rent or whatever. But now, as you see now, the evictions and stuff has risen up. So all these things are culminating into a big collapse, man. So when it happens, people, as they say, is going to be asked out, But this is why we need to trust in the Lord. In the book of Sirach, because these things is happening, man. It's happening bit by bit, but it's happening. It's coming. It's Sirach 2 and verse 10. It says, "Look at the generations of old and see, did ever any trust in the Most High was confounded, or did any abide in his fear and was forsaken? Or whom did he ever despise or call upon him?" The answer is none. You know what I'm saying? So, as our ancestors of old, they trusted in the Lord and they wasn't despised or confounded. So, in like manner, we have to trust in the Lord when these things are, come upon us, because, we are gonna, lose our jobs and stuff, and all these things is happening, to weigh us down. Weigh us down spiritually, weigh us down mentally, weigh us down physically. And I find that in the book of Daniel, chapter 7, and verse 25. It says, "And he shall speak great words against the Most High, and shall wear out the saints of the Most High." To change the times and laws, right? To change our feast days, to change, our high holy days, and how we keep the new moon Sabbaths and stuff. and they shall be given into his hand until a time and times and the dividing of time. So those that say that Jacob's trouble don't exist, you know what I mean, they are in for a rude awakening, because, as in times of old, we would also be given, the issue of our time, to be tried, to be tested, you know, to be locked up, to be questioned about our beliefs, so on and so forth. You understand? So this is one of the ways that they wear people out, by taking these, these dependent situations, where you can rely on medicine, cheap medicine, and so on and so forth. Another way that they wear out is by killing you with work. People that I know that is working, they are tired. They are tired of working 10, 12 hours, especially now that the Lord has shortened the days for the elect's sake. So it's going by quickly. So, you go to work, before you know it, you take a nap, it's time to go back to work again. So people is being, worn out. So back to the article. It says the provision was initially tied to the national public health emergency, but lawmakers changed that as part of the federal spending bill. As part of the federal spending bill that passed in December, in addition to being able to start conducting terminations in April, states will receive an enhanced federal match through the rest of this year, though it will phase down over time. More than 92 million Americans were enrolled in Medicaid and Children's Health Insurance Program in December. That is a lot, up 31% since February 2020, according to the most recent data available from the Centers for Medicare and Medicaid Services. Reviewing the eligibility of all those enrollees will be a monumental task for state Medicaid agencies, many of which are also contending with slim staffing. To gear up, they are hiring new employees, temporary workers, or contractors, or bringing back retirees, according to a recent survey conducted by Georgetown and Kaiser Family Foundation. Most states can automatically renew coverage for at least some of their enrollees using other data, such as state wage information, but agencies must get in touch with others in their Medicaid programs, which proved challenging even prior to the epidemic. Most states are using multiple methods to update enrollees' contact information, including working with insurers that provide Medicaid coverage to residents. If notices sent by mail are returned, states must make good faith attempts to contact enrollees through at least two other methods before cutting them off. And states have to adhere to additional requirements to continue to qualify for the enhanced match. If they don't, CMS also could suspend their terminations, require they take corrective action, or impose monetary penalties. Of the roughly 15 million who could lose Medicaid coverage, about 8.2 million will no longer qualify. So no matter what happened, they're getting people off. According to a Department of Health and Human Services analysis released in August, some 2.7 million of these folks would qualify for enhanced federal subsidies for Affordable Care Act policies that could bring their monthly premiums to as low as zero. Now, you see what Esau doing here? He letting some people off, but then he may keep some on, right? It's going to be the same thing when he bring the MOTB. You understand? He's going to cut some people off, and then he's going to make it favorable. Pretty much give scraps to those who is willing to take the mark. So we got some tough times coming, man. Says some 6.8 million people, however, will be disenrolled even though they remain eligible. So you see, you're gonna cut. This is the time of cutting off. Faster timeline for some states says though the federal government has given states more than a year to conduct the eligibility reviews and terminations, some plan to move much more quickly. Idaho, which has been monitoring enrollees eligible throughout the pandemic, I said it, plans to complete its reevaluations by September, which it touts as one of the fastest timelines in the country. Of the nearly 450,000 Idahoans in the program, about 150,000 of them either don't qualify or haven't been in touch with the state in the past 3 years. The state began sending notices in February to those who face termination. People have 60 days to respond before they are removed. Those that are not eligible have 60 days from their termination date to enroll in Idaho's state-based Obamacare exchange. It says, Your Health Idaho. The exchange receives information nightly from the state Medicaid agency as residents who no longer qualify for public coverage but may be eligible for federal subsidies for Affordable Care Act policies. It says the exchange is reaching out to those folks weekly while they still have Medicaid, and then every 15 days during the 2-month special enrollment period via various methods, including mail, email, and text messages, said Pat Kelly, Your Health Idaho's executive director. The exchange works with 900 agents, brokers, and enrollment counselors who can help folks sign up for policies, and it plans to start an advertisement campaign this month highlighting the hefty subsidies. We have to really help Idahoans know and understand that low-cost options are available, but most importantly that it's comprehensive health insurance that they can get for $0 a month, Kelly said. Still, advocates in Idaho are concerned that the state's push to unwind quickly will result in eligible residents losing coverage. Many people are not aware that they once again need to prove that they qualify, and the state agency is understaffed and underfunded, said Hillary Hagan, Health Policy Associate at Idaho Voice for Children. Renewal letters may not make it to enrollees, and those who need help may not be able to get it through customer service. So you're looking at a shit show that's ready to happen. We are very concerned about families and particularly children losing health coverage without their knowledge that they will find out when they show up to the doctor, Hagan said. Aware that many people don't know they'll have to renew their eligibility, Arizona's Medicaid agency last summer sent text messages and letters and made robocalls to enrollees asking them to update their contact information. It is also working with community partners, health care providers, pharmacies, insurance, and it's ramping up another text campaign since the prior one was so successful, said Heidi Capriotti, Public Information Officer for the Arizona Healthcare Cost Containment System. While the state can automatically redetermine the eligibility of about 75% of its Medicaid participants, it still has to connect with about 670,000 residents who could lose coverage because they are no longer eligible or they haven't responded to the agency's request. The state plans to take 12 months to assess whether it enrollee still qualifies. So like I'm about to drink some water real quick. Yeah. Next heading, it says, not waiting for Medicaid expansion to begin. South Dakota will start terminating Medicaid enrollees in April. As you all know, we're already in April, so it started already. Though some low-income adults may become eligible again in July, when the state's Medicaid expansion program begins. Voters approved the broadening of Medicaid to low-income adults at the ballot box in November over the objections of the Republican governor and legislature. Nearly 152,000 residents were enrolled in Medicaid in January, an increase of more than 30% from March 2020, according to the state's Department of Social Services. But more than 22,000 people appear to be ineligible currently. It says the state said in a fact that it will prioritize reviewing folks who are most likely to be ineligible because they no longer meet the coverage group or their income has increased, among other reasons. Those who are not eligible will be disenrolled with 10 days notice. If they appear eligible for expansion in July, they will receive a notice about it when they are terminated and sent a reminder in June. The agency is encouraging any enrollees who are determined to be ineligible to reapply after Medicaid expansion takes effect. But that 3-month gap can wreak havoc on low-income residents' health, said Jen Dresky, Deputy Director of South Dakota Voices for Peace, which is working with the state's immigrants and refugees to inform them of the unwinding. These folks may have to go without their heart medication or their cancer treatment. They may also be afraid to go to the doctor because of the cost. Hell yeah. Says, why can't we just wait until July 1st? Dresk said, our concern is that people are going to get sick or die because they're not going to be able to access the health care that they so desperately needed. The CNN wire. So all these things is culminating to, more uproars of the people. You understand? So these people, like they said, when they need, heart medication, cancer treatments, cancer medication, people is gonna protest in the streets, man, because of the treatment. You understand? So Esau, the elderly among Esau, Edom, and the other nation, they're gonna feel it. But particularly, it says the low income is gonna affect low income people, and that is mainly our people, the southern kingdom, southern tribes, and the northern kingdom as well. Right? But the scripture is in Revelation 12 and 11, it says, they love not their lives unto death. Let me grab that real quick, because this is not our rest, man. This is Revelation 12 and 11. It says, and they overcame him by the blood of the Lamb and by the word of the by the word of their testimony, and they love not their lives unto death. This is the elect. You understand? We wanna, Lord willing, we be of the of that number. I mean, we hit it here. We want to see judgment. We want this thing, be done with. It also says in the book of John, to finish it off, 12 and 25. It says, "He that loveth his life shall lose it, and he that hateth his life in this world shall keep it unto life eternal." So the people that want to stay here, and and live off the system, of the benefits of the teats, you understand, they're gonna be held in derision. They're gonna be destroyed, right? But those that hate it here, the Most High is gonna preserve and save them. All right, so I just wanted to share this out real quick because we are called to be watchmen, to blow the trumpet and warn the people. So these things is to help you to trust in the Most High further, and to have that 100% faith in Him. Have faith, walk in faith, but not by sight. You know what I mean? So Lord willing, this is a symbol that the final elect. And until the next time, I say shalom.